The way to learn the muscle motors of the spine are by groups. And I want you to remember that the muscles that we touch when we pat someone on the back are limb effectors. They're the superficial extrinsics, and they include the trapezius, lats, levator scapula, and rhomboids. So you're looking here at the superficial muscles. They're limb effectors. They're not spinal effectors. And then if we dissect out the traps, we find the rhomboids present and the levators, well, the levator scapulas. I'll take it back. Levator scapulas here. This is upper trap, middle trap, lower trap. So these are the superficial posterior spinal muscles. Now, or the extrinsics. The intermediate extrinsics are effectors of breathing, secondary muscles of respiration. The serratus posterior superior is a muscle of inhalation, and the serratus posterior inferior is a muscle of exhalation. The intrinsic posterior muscles, the first group that we come to are the superficial group, and they include the splenius capitis. Capitis means head, capitate is head, and splenius cervicis. And there's one of each, both left and right. When they fire, all four of those muscles fire concentrically, it causes extension of the neck. When they contract eccentrically, they control the rate and extent of flexion. So be way familiar with these superficial intrinsics. And appreciate the fact, if there's a unilateral, if I start in this position and my intention is to bring my ear to my shoulder, I'm laterally flexing, and these two muscles, splenius capitis and cervicis, are major contributors to concentric lateral flexion, same side. Now once I get past neutral, it's the contralateral through eccentric contraction that controls the rate of my lateral flexion. We've rehearsed this a little bit, but we'll rehearse it again in class on Tuesday. And then we come to the really significant muscles in terms of area covered, and these are the intermediate intrinsics. Now, as a group, they're called the erector spinae, and starting lateral to medial, the iliocostalis, its name tells you what it does. It attaches inferiorly on the iliacus. I've got to make sure I'm pointing in the right place. On the iliacus, and there's portions of this through sacral, lumbar, and thoracic regions. It doesn't go up into the cervical region. The next is the longissimus, and it has regions that include sacral, thoracic, and cervical. Now, and then the spinalis is the one closest to the spinous processes, and again covers all the way from sacrum to cervical region. Appreciate the fact that when bilateral, right and left, contract, they're extensors. They're in concert in extension. When unilateral contraction occurs, they're lateral flexors, same side. Now, if I'm laying on my left side and I want to laterally flex through that entire range of motion from, if I'd say neutral, and then as far as I can possibly laterally flex, they're firing. But if I'm standing upright and I go from neutral to that posture, it's really the contralateral muscles that are contracting eccentrically. These guys are not firing hard in that position. And then these muscles tend to rotate. If you look at iliocostalis, when these component parts if this is the dock and the ribs are the boat, they would rotate us to the same side. It would draw the rib cage and the vertebrae and rotation same side. And then we go into the little serial muscles that are the deep intrinsics. I give you examples, and this is not an exhaustive list, but these are muscles that are just way small, and they move from one spinous process to the transverse process, or from transverse process to transverse process, or from spinous process to spinous process. There are a whole series of little packets of muscle, and because all of these posterior muscles, except for the superficial extrinsics, all of them are posterior to the frontal axis. The frontal axis we lay here, they are extensors. Okay, bilateral, left and right, they're extensors. Unilaterally, they're lateral flexors, and they rotate us opposite. They rotate us opposite. Here's another look at the interspinalis and the intertransversari, and if you'll look at these muscles, if this is fixed, this would draw and rotate this vertebrae this direction. Or if we went to the rotatories, longus and brevis, if you see this contracting, this is a fixed point here, and this contracts concentrically, it's going to rotate us opposite. So just memorize that the deep intrinsics rotate us opposite. So that means that the right side deep intrinsics will rotate us left and vice versa. And then muscles of the anterior cervical spine, the rectus longus capitis and the longus colli, are flexors and lateral flexors. These are so deep that we don't have a chance to really do a lot of palpation or have satisfying palpation, but know that they're there. They're the muscles that get sore when we've had a whiplash injury. So when we get rear-ended, we come into extension, and these are eccentrically contracting, trying to slow us down, and the next day we go, man, why is the anterior part of my neck sore? Well, that's why they went through a big eccentric loading. And then the anterior muscles of the abdomen, the rectus abdominis, the external oblique, the internal oblique, and then the transverse abdominis. You know that these are flexors, and the external oblique or external rotators are rotators opposite, so the right side rotates us left and vice versa. The internal rotators rotate us same side. And then working unilaterally, they're lateral flexors concentrically, which means that they control the rate and extent of hyperextension. So eccentrically, they control extension, hyperextension. And okay, so and then laterally situated, the quadratus lumborum, its name tells you its shape and the location in the spine where it's operative, because it's lateral to the sagittal axis. When it contracts concentrically, it's going to laterally flex the same side. Eccentrically, it controls the rate of lateral flexion opposite. And then we've spent quite a bit of time on the psoas. If we consider that this is the anchoring point, when the psoas contracts, it flexes the spine on the femur concentrically. We've come out of the lower extremity, and you know if we fix the spine, it flexes the femur on the spine. Okay, really problematic in terms of getting too short. And then muscles of the lateral cervical spine, the scalenes or the scaleni, anterior, middle, and posterior. You can see by their location that they're lateral flexors. The sternocleidomastoid, its name tells you, sterno the sternum, cleido meaning clavicle, mastoid process, okay? And when this contracts, it rotates our head the opposite direction. So the right side rotates us concentrically to the left. And then the levator scapula right here attaches to the superior angle of the scapula. That's right there, the superior angle, and goes to the cervical spine. And when this is fixed, it laterally flexes that way. If we fix the spine, its name tells us that it's elevators of the scapula. And then muscles of respiration. You know, the primary muscle of respiration is the diaphragm. And what happens is when it contracts, it pushes abdominal contents inferiorly. That creates a negative pressure in the thorax, and that draws air in. So it is. And then when it relaxes, okay, it's the diaphragmatic action that causes us to be able to draw air in through a negative pressure. Pushes us down, opens up the thorax, draws air in the mouth, relax it, it exhales. Well, there's times when we need to forcefully exhale, and it's the secondary muscles of respiration. The serratus posterior superior is inhalation. Think of these ribs as a bucket handle, like a bucket that you'd use to wash your car, and that lifts the bucket, contributes to drawing air in. When we need to forcefully exhale air because we're turning over our air more quickly, the muscles of exhalation, the serratus posterior inferior, and the abdominals. You can see the rectus abdominis. When it contracts, it's going to pull the handles of those ribs down, and those will force exhalation. In people who are really ill with chronic obstructive pulmonary disease, you'll see that their secondary muscles of respiration are huge because they're just needing to move more air than they're able to, called COPD. This is a condition called cachexia, where there's great wasting of the person's muscle tissue, and yet the irony is their muscles of respiration will really be hypertrophied. Well, I hope that's helpful to you on going with areas of emphasis on the spine and the muscle motors that move us, and God bless you. It's good to work with you. Bye-bye.